Hello, my name is Mattias Von. I'm the CEO of NextCell Pharma and one of the co-founders of the company. We develop cell therapies to treat autoimmune diseases and inflammatory states. And our lead candidate is called ProTrans. It is a cell therapy and it consists of mesenchymal stem cells derived from umbilical cord tissue. And we use these cells to protect the patient's own insulin production. So our primary indication is type 1 diabetes. We have so far conducted trials both in phase 1 and phase 2 and have positive efficacy data and safety data. We recently commenced in COVID-19 and we have yet another indication that is in the preclinic. So ProTrans is more of a platform technology to treat hyperactive immune systems. In addition to ProTrans, we also have the Nordic's largest stem cell bank that's called CellaViva, but I will only talk about ProTrans. So, in the schematic to the left, we have a mesenchymal stem cells. These kind of cells, they can differentiate into becoming fat, bone, cartilage, but they also have a very important role as balancing the immune system in the body. So these mesenchymal stem cells, they interact with virtually all the different immune cells to regulate the balance between inflammation and regeneration. And when it comes to autoimmune diseases such as type 1 diabetes, we have a hyperactive immune system. In the picture to the right, we see a small schematic of a patient where the immune cells are recognizing insulin and the insulin producing cells as something foreign and start to degrade these kinds of cells. And that is the process that we want to revert to stop this hyperinflammation. So when it comes to type 1 diabetes, it is an autoimmune disease with a huge medical need. It is a lifelong disease, and the only treatment option we have is to give insulin, which is really treating the symptom and not treating the underlying disease. So we would rather like to revert the balance and stop the autoimmune attacking of the beta cells. We have conducted 2 trials, ProTrans 1 and 2. It treats patients with that had their diagnosis during the last 2 years, and we have treated adults. ProTrans 1 was looking at different doses, and we saw that low, medium, and high dose were all very safe. We had no severe adverse events, and we saw a dose-dependent efficacy where the patients treated with medium or high dose had a treatment benefit over the patients treated with low dose. So we continued with a randomized placebo-controlled double-blinded trial, giving 10 patients high dose ProTrans and 5 patients placebo. Primary endpoint has been adverse events, but also giving a single infusion and looking at the patient's own insulin production before treatment and 12 months after. And we saw in the randomized placebo-controlled trial that we had a treatment effect. Patients treated with ProTrans were statistically significant better during 12 months after treatment than the patients receiving placebo. Actually, 4 out of 15 patients treated with high-dose ProTrans had an increase in endogenous insulin production, and there were no patients in the placebo low-dose cohorts that were doing that well. Looking at the patients that had more or less the same level of insulin production before treatment and 1 year after, we saw that half of the patients were in that range, whereas in the placebo low-dose patients there were no patients doing that well. So we have a clinical trial program where we are assessing long-term effect, repeated treatment. We also want to go into younger patients, but the big thing now is preparing for our phase 3 trial. That's called ProTrans3. I mentioned that we are also looking at COVID-19. For the sake of time, I can't go more into detail, but just explaining that the later part of COVID is a hyperinflammation in the lung that is very suitable for mesenchymal treatment, something that we will investigate along with type 1 diabetes. So we have a very interesting clinical trial program, and we have quite some highlights. So I welcome you to look more at NextCell Pharma, and please reach out for more details. Thank you.